Hi there, my name is Professor Mark Tully, Professor of Public Health here at Ulster University. Thank you for this opportunity to present something of the impact of COVID-19 in Northern Ireland and the current situation here. What I'm going to do is give you a quick introduction to how Northern Ireland is organised, what we're like, then how public health is organised here, what the impact of COVID-19 has been in terms of infection rates and mortality rates, and my colleague Dr. John Cathcart is going to present the impact of COVID-19 on our healthcare system and on people working in healthcare services. Ulster University is where we're based. It has about 25,000 students and is internationally recognised for its applied research, particularly in the areas of health and healthcare. Impact is one of the things we really focus on, so a lot of our research is about making changes to real-world clinical practice. I'm Director of the Institute of Mental Health Sciences, and within that role we have a multidisciplinary team across the faculty addressing the mental health and well-being impacts of various aspects of society, including COVID-19. Northern Ireland itself is quite small. We've got a population of about 1.8 million. We have one major city, which is Belfast, and a number of smaller cities. But when we say major city, it's got about 344,000 people living in it, so it's really not that big. Northern Ireland itself is situated at the top left of Europe and is part of the United Kingdom. So if you'll know England, you'll know London. Within the United Kingdom there is 4 regional countries, England, Scotland, Wales and Northern Ireland. So we're governed partly from England and partly locally as well. In terms of ethnicity, we are 98% white, largely white Irish, and that has unique, means we don't have the BAME communities that have been impacted by COVID-19 in other areas. The one thing we do know about Northern Ireland, or if you've ever been to Ireland, you'll know that it rains here a lot. So the average rainfall in Northern Ireland is about 157 days a year. Why is that relevant to a talk on COVID-19? Well, what we know is that in inclement weather it drives people indoors and increases transmission. So this is what we've seen this winter when our rain has started to fall. So the way Northern Ireland's set up is we have a regional assembly, an executive which looks after some of the legislation in Northern Ireland. It's based at this building called Stormont Castle, and we've got a number of government departments. So health is a devolved issue, so we can make our own decisions around health and have a unique budget for that. But other issues like travel are enforced from England, from the English government, and therefore travel restrictions, we have to follow what's happening with our colleagues in England. So that allows us some flexibility in our response and a unique response to some of these things. What are we known for? We're known for unique landscapes. The Giant's Causeway is a UNESCO World Heritage Site. Lots of green grass thanks to that rainfall, and we have wonderful settings. Northern Ireland itself has a troubled past of political unrest, and some people may know it for that, and since the Good Friday Agreement we've had a number of decades of relative peace and quiet. The impact of that, however, has been that, albeit we have really good access to green space, a really well set up society, there's a legacy of mental health problems and social inequalities resulting from these political troubles that have occurred, that we're still dealing with and are still coming out in our health of our nation. The other thing we like to promote is our golf, and golfers like Rory McIlroy come from here, and so there's lots of opportunity for leisure in Northern Ireland too, with some of the top golf courses. In terms of an industrial heritage then, that was a bit on our sort of cultural past. Well known for our mechanical industrial heritage, shipbuilding, linen factories were really how Northern Ireland was built. And the Titanic was built in Northern Ireland. We always say when it sailed out of Belfast it was perfectly fine. It was when it left England that it sank. But well known for building lots of ships and a long tradition of that. The pneumatic tyre was invented in Northern Ireland by John Dunlop, and so cycling is a very strong historical relevance in Northern Ireland. And as well as that, where I was trained was in the department where Frank Pantridge came from, which he invented the portable cardiac defibrillator. So it was the first time defibrillators were taken out of the hospital and into the community in ambulances at the time. So lots of innovation, lots of invention. More recently, our we've become known for our film and TV work. So Game of Thrones was filmed here, and a number of other film and TV programs are filmed here. And there's a big societal move towards opportunities for film and TV production in Northern Ireland. So in terms of COVID-19 then, the first case was discovered in Northern Ireland on the 27th of February in 2020. And it took nearly just over 3 weeks for the first death to occur, and a month until we started public health measures to combat the transmission. And the first lockdown one, as we call it, was really a stay-at-home order. So schools were closed, non-essential retail was closed, vulnerable adults were ordered to shield, and that shielding, they remained shielding right up into the summer. Our schools were closed, and our schools closed right through to the summer term, so it didn't reopen again for the rest of that academic year. Our universities closed for all but essential face-to-face teaching, so we had a very small presence on campus, but it was students in the hundreds, not in the thousands. And that situation didn't really change until the summer, and we started to see a dip in the infection rates in the summer, and we started to open retail again, and organised outdoor sports were allowed to start again. Hospitality opened up in July. And one of the major initiatives in the UK which caused a spike in our infection rates was the Eat Out to Help Out scheme. So the government in the UK government, run from England, put in a scheme that there was money off to dine in restaurants midweek. And so lots of people took advantage of that, and our transmission rates went up. So our transmission rates went back up again in August. We did at that point put in legislation compulsory face coverings to be worn in all major indoor settings such as shops. But then we had to go back into another form of lockdown towards the end of September, following another spike, which we call lockdown 2. Hospitality was initially closed, and then schools closed for a 2-week period. And that seemed to drive our R rate down sufficiently that things started to reopen again in December. The government were very keen to open up opportunity for people to meet up over Christmas, and that was allowed. So people were allowed to meet indoors for Christmas for short periods of time. We saw a spike in retail use as well, and we've seen a subsequent spike in our infection rate. So we entered our third lockdown, which we're currently in, on the 26th of December, where we have no organised sports, no indoor gatherings are allowed, 25 people in a funeral or at a wedding. Schools are now closed again, and we don't know when they're going to open. Universities are still teaching online primarily, and non-essential retail is closed, and that's likely to be in place for at least another month, if not more. So how the response was organised here. So we have a Department of Health that set the health strategy and health policy, and then we have a public health agency that are the practitioners. And that was organised in a number of what they call cells. So there were cells around logistic supplies, addressing shortfalls of PPE in the early phases of the pandemic, infection control and transmission, particularly in hospitals, a communication and media cell to make sure that the messages around current restrictions and legislations were being put out, a knowledge management cell, which is a cell where we have an active pursuit of literature to make sure we're up to date with what the current understanding is, a data management cell, and a technical scientific cell. And I sit on the technical scientific cell in the Public Health Agency, advising on the latest research evidence. And then there's also a behaviour change cell, which offers behavioural insights into responses to the pandemic locally, and I sit on that committee too. So our Department of Health, there are 3 main things that they focus on are maintaining a distance, and we started off with a 2-metre distance, and that's been reduced to a 1+ distance. So we do allow people, if they necessary, to be within 1 metre of each other, but that there should be ventilation and face coverings while they're doing that, hand washing. And this kind of social norm message of we all must do it is really being put out to promote a collective response to COVID-19. We have an active testing and tracing system for new infections, which has been in place for some time, and we were one of the first countries in Europe to roll out a digital solution to test and tracing, which was our Stop COVID NI app. And approximately a third of the population have this app downloaded on their phone, and if one phone comes in close contact with another phone of someone who has tested positive recently, an alert is sent and an order to self-isolate for 10 days, which is what our self-isolation period is given. So if you test positive or if you're in close contact, there's a self-isolation period of 10 days. We've already reviewed the COVID restrictions that are in place, and those are reviewed on a fortnightly basis by our government executive with advice from both the public health practitioners and scientists. There's a number of help and support lines that have been set up, both for to support people who are out of work, and so there's a furlough scheme in place. Initially, if your business was closed or you were out of work, you were paid 80% of your salary by the government. That's reduced now that the government only pay part of that, and your employer is expected to pay another part of that. And we've been rolling out the COVID vaccine here. The UK was one of the first countries to bring in the COVID vaccine, and Northern Ireland have done pretty well around that. So how have our numbers looked? Well, what we've seen, you can see here from the percentage positivity, you can see the three phases of infection, the three spikes, if you like, the three surges. The early one, where we were getting a positivity rate of around 25% of people tested, and our testing capacity increased over time. Over the summer months, that certainly went down quite considerably. We saw that spike in October and November, and then more recently a very significant spike just after the Christmas period, which is where we currently are. If we look at that in terms of mortality then, what we've seen is overall a death rate of about 1,600 when we look at the public health surveillance systems. But if we look at a broader surveillance system, it's about 2,500 deaths attributed to COVID-19 since the part of the pandemic. So it isn't a terribly large number, but as a mortality rate, it's about the same as what we see in other countries. One of the things that we track carefully, as many countries do, is the number of patients in hospital with COVID-19. And what we've seen in the most recent time on the far right there, which reflects the start of January, is a huge spike in the number of inpatients who've tested positive for COVID-19. And this has put a significant stress on the current health system to the effect that elective surgeries are being cancelled and a number of other procedures are being cancelled, a lot of outpatient clinics. John will talk about that a bit later. We also take a look at the percentage by age group, and what we see in Northern Ireland, that it is largely the 20s and 30s where we've seen the biggest growth in infection rates. So there's been some growth in children, but where we see the biggest growth in the proportion testing positive is in that rate, a fairly constant rate of those who are over 80, and indeed over some increase in those who are over 60. And so most of the transmission is probably occurring in that sort of certainly 20 to 60, but probably 20 to 40-year-old age group. Like most countries, our death rate is skewed with significant age distribution, so we do consistently have seen that people over 80 have the highest risk of mortality, and those of other vulnerabilities such as pre-existing clinical conditions. One thing to note in this though is our response in terms of the COVID vaccine. So we are currently, in terms of the share of the population who've received one dose of the vaccine, we are fourth in the world. Israel obviously leading the way, but we've done very well in rolling that out, and part of that is our small geography and our strong local community support. So that's been rolled out at the moment for healthcare staff in hospitals, for patients in hospitals, for residents in nursing homes, and now for patients over 80 through primary care. February we will start to roll that out to patients over 70 in primary care. And in the UK they've changed the way they're delivering the vaccine, so most of the current vaccines require 2 doses. At the moment we're prioritising people to get the first dose first and get as many people with the first dose as we can, and then the second dose will come at some point whenever stocks allow it. The other thing I wanted to look at with you was looking at mobility data. So Google and Apple have been producing mobility data based on phone users and where they are. And there's a couple of important trends I think to look at in this in terms of Northern Ireland. The blue lines here represent Northern Ireland, very similar to the orange UK as a whole. And what we saw was the number of people who were in workplaces on a daily basis dropped significantly after the lockdown was introduced at the end of March. You can see that decline on the left-hand side, and then slowly and steadily increased over the summer months, and in the subsequent second and third lockdowns never really reduced that much. Now, the second lockdown wasn't as restrictive, so that's probably the reason for that one, which is around the October-November period. We do see a dip there on the right-hand side. Those are Christmas holidays, so people wouldn't be in work then. But you'll see that at the far right of that graph, the number of people in workplaces, even though we now have the same level of restriction in place as we had at the start of the pandemic, we see significantly more people still in workplaces. So we anticipate that there's at least some transmission occurring in workplaces. In terms of public transport then, what we've seen is a significant decline in public transport use, and that has increased somewhat over time, but not got back to the levels before or anywhere close to it. Retail and recreation use is another area of interest, and when those services closed, we saw that declined, and then as people became more confident over the summer, they came back out again. And what we saw was a spike in retail and recreation just before Christmas, as those were allowed to open up again after lockdown 2, and that coincided with an increase in transmission rates. So certainly another area where we anticipate there has been significant transmission is in densely packed retail shops. These is compliance with the stay-at-home order, and we see an increase in the number of people who are staying at home and declined over time. But a large portion of people have returned to that stay-at-home order under the current restrictions as well, which is quite positive. So that's a snapshot through the response in Northern Ireland. Our numbers certainly have been quite high on a per 100 rate, but there's been a coordinated response right across public health to that, and a rapid rollout of the vaccine is certainly something that we think will help us return to somewhat normal, hopefully by the summer, although we anticipate that there'll be ongoing vaccine programs probably for the next couple of years. Thank you for listening. I'm going to hand over to my colleague, Dr. Cathcart, to talk through the implications on our health system.